So she's the person that hopefully you hope to see if you end up in the ER, although it may come after a wait. But when you make that call, 911, you're expecting a paramedic to come to your house fairly quickly. And Connor Chartier is a paramedic. He works in the Edmonton area, and we're going to connect with him now. Hi, Connor.
Hey, Ian. Good to be on the show.
Yeah, really nice to have you on the program. Let's start with that call to 911, something most of us have not done. And when somebody does do it, they're usually in a pretty tough situation, and they are assuming the ambulance is going to get there in a few minutes. In your experience, what's happening now?
Yeah, and I can only speak from my experience, my personal thoughts. On this preference that I don't speak for my employer. But there is a shortage, and Freedom of Information request obtained by Alberta's NDP showed that in Edmonton, the area that I work in, saw 859 instances in the month of May without ambulances. This totaled for over 24 cumulative hours of no ambulances in a city of approximately 1 million people. We're short on resources. They're not being added as our population continues to grow. And it's really just a symptom of a larger system-wide problem. It's one of these problems that starts at the top and kind of flows down. So when we talk about upstairs in a hospital, we're talking about acute care beds and ICUs. And as we've heard from other callers, those spaces are full, and then emergency departments aren't able to admit those patients upstairs, which then means paramedics such as myself are unable to give their patients over to the emergency department. And it just kind of flows down and right out the doors of our hospitals there. So yeah, when ambulances are available, we get there and we work to get there as quickly as we can. But we don't have the resources right now, I don't think.
As a working paramedic, what is it like when you get to a call and the people there have been waiting too long in their minds?
Yeah, it's frustrating. I'll even go a little before that. As we're on our way to the call, myself and my coworkers, I know that we drive and we feel terrible because sometimes we're going to people that have been waiting 1, 2, maybe up to 3 hours since they called 911. And we'll show up on scene, and sometimes that patient's not even there anymore. They've left. They've found an alternative route to the hospital. And when people are there, we have to work on providing the appropriate life-saving care, but sometimes we're also diffusing really tense situations. People are calling 911 on some of their worst days, and that's just an everyday for us, and we need to respond with compassion and take that approach and let them know that, hey, we got there as quick as we could, but unfortunately we were stuck helping someone else, and so were all of our colleagues. So trying to provide that appropriate care while diffusing these tense situations can be very hard, and it's very wears down a lot of the practitioners, I think.
These situations are difficult all the time. Do you get a sense that it's getting worse now, again, based on your personal experience?
Yeah, it's really tough to say, is it getting worse? There's so many factors that play in, and it's often been dismissed as COVID. But long before COVID existed the opiate epidemic, and that seriously impacts EMS and the resources that we see. Statistics Canada released numbers between April of 2020 and March of 2021, and we saw a 96% increase in opiate-related deaths across the country, and a 27% increase in hospitalizations for opiate use over that same period. So we're often responding, because these are real emergencies. These are where people aren't breathing and need immediate life-saving care. So it's difficult to pin it on one thing. It's a lack of resources. It's the opiate epidemic. Yes, COVID does play a role in it, but we can only do so much with what we have.
How is all of this affecting you?
Yeah, it's difficult. I try to be cognizant and look out for signs of compassion, fatigue, burnout, and just exhaustion. It's really frustrating to me when I reflect back on my time with a patient and I say, hey, I could have been more patient. I could have been more caring. And it's even harder when it spills over into my personal life and I find myself easily irritable at home around the people that I love. And that it leads to sleep disturbances for a lot of people as well. That was why I first called into the show, got in touch with you guys, was talking about shift work and sleep and that stuff. So it's wearing people down, and that's why we're seeing some people leave the profession at times.
Yeah, and tell me about that. Where are they going?
Well, we walk a fine line between healthcare and public safety. We're kind of in between nurses and doctors and respiratory therapists and all that, and then police and fire on the other side. And we don't fully belong to one category or the other. But when people leave the profession, sometimes they'll go to be a firefighter, sometimes they'll go over to be something like a nurse. And I think in these areas, they might feel better appreciated or more fairly compensated. But I know that you're going to have lots of nurse callers on the show too that say they're just worn out, they're exhausted. So it's hard to say where we go from here.
Well, I do appreciate getting your perspective because I do think that we don't hear enough from paramedics, and you guys are seeing the challenges in the healthcare system from the moment you respond to a call to the moment you're finally able to hand the patient over to the emergency department. So, Connor, thank you very much for taking our call.
Yeah, Ian, I appreciate you lending your show to the issues that matter.
Connor Chartier is a paramedic.